Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power.
Hi, I'm Dr. Paul, and today we're going to talk about SIBO, or small intestinal bacterial overgrowth, and some of the symptoms associated with SIBO. So what exactly is SIBO? SIBO, or small intestinal bacterial overgrowth, is when we have bacteria in the colon that translocate and move up into the small intestine, contributing to bacterial overgrowth. Next, what are some of the common symptoms associated with SIBO? Some of the most common SIBO symptoms are bloating and gas, especially after eating, abdominal pain, constipation or diarrhea, heartburn, indigestion, nausea, fatigue, brain fog, malnutrition, sense of fullness after eating, and more. Many of these symptoms occur from the bacteria in the small intestine feeding and fermenting on undigested foods and specific carbohydrates. These bacteria then release certain gases and inflammation, which then contribute to symptoms. Another really good question to ask is, how does SIBO impact nutrient absorption? Remember, with SIBO, you have bacteria in the colon that move up into the small intestine where we absorb most of our nutrients. The bacteria that is now present in the small intestine starts consuming some of these key nutrients before we can absorb them into the bloodstream, which leads to nutritional deficiencies. These nutritional deficiencies can then lead to several symptoms and negatively impact the healing process. Another thing that you may notice with SIBO is changes in your stools or bowel movements. With SIBO, your stools may fit some of the following descriptions. Your stools may float or be more oily due to fat malabsorption, which can require more wiping, and you also may see some streaking in the toilet due to fat in the stool. Your stools may also contain mucus, and your stools may also be thin and pencil-like or soft and not well formed. And now to maybe the most important question of them all. What causes SIBO? So what are some of the most common causes of SIBO? The first one I have on the list is low stomach acid or hypochlorhydria. Your stomach acid is your great protector that helps kill microbes that are in your saliva and on your food. If you don't have enough stomach acid, some of these microbes can work their way down into the gut and contribute to overgrowth and symptoms. Next on the list is dysfunctional immune system, followed by antibiotic use. Antibiotics can wipe out a lot of the beneficial bacteria, which can then allow for opportunistic bacteria and other microbes to become overgrown, causing dysbiosis or imbalance in the gut. Next is slow motility or constipation. And finally, a history of gastrointestinal surgeries that may impact the stomach, small intestine, ileocecal valve, or colon. How about risk factors? Are there any risk factors for SIBO? Some of the more common risk factors that we see with SIBO are low stomach acid, slow motility or constipation, a history of gastrointestinal surgery, diverticulosis of the small intestine, Crohn's disease, ulcerative colitis, radiation treatment to the abdomen, several chronic inflammatory conditions including celiac disease, diabetes, IBS, and more. There can also be some complications associated with SIBO. The one we talk about most often is chronic malnutrition or nutritional deficiencies, which can lead to several other symptoms and conditions. Another complication can be other chronic digestive issues due to long-term dysbiosis or imbalance in the gut microbiome, dehydration, and more. When we're talking about SIBO, we always have to talk about potential food triggers. With SIBO, some of the most common food triggers are from different forms of carbohydrates. The biggest category of carbohydrates that are triggers in SIBO are high FODMAP foods. FODMAPs stand for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These different sugars and carbohydrates provide fuel for the bacteria that then lead to symptoms. Here's a list of some common high FODMAP foods and low FODMAP foods. While all this information can be useful, at Restorative Health Solutions, we take a comprehensive approach to SIBO. With SIBO, we feel it's very important to get accurate and comprehensive testing. The gold standard test when it comes to diagnosing SIBO is the breath test, but its reliability has been in question due to the susceptibility of false positive and false negative test results. At Restorative Health Solutions, we use other tests to look at the whole picture. We test several things, such as genetics for gluten sensitivity. We look at food allergy profiles. We look at food sensitivity panels. We look at stool testing and organic acid testing to look at the microbiome. We look at nutritional deficiencies. We look at adrenal and cortisol panels and more. We know that we cannot diagnose SIBO with a stool test, but we can look for certain findings that suggest bacterial overgrowth. The additional testing can help us make that diet individualized along with a supplement protocol. Remember, this is a one-size-fits-one approach and not a one-size-fits-all approach. Well, I hope you learned a little bit today about SIBO and some of the symptoms that come along with SIBO, and until next time, I'm Dr. Paul.